Now I want to talk about the use of visible light or near-infrared light in conjunction with a sensitizer, which I described as photodynamic therapy. What happens here, we can see in the next slide. Here we have a patient who has a tumor, and you first of all inject into the bloodstream, into a vein, the dye stuff, which will travel around the body and will then be located preferentially, will be retained preferentially in the tumor. Now on this picture, unusually, the tumor is located in the patient's leg. Normally it would be in one of the internal organs, but the artist who drew this didn't know that when we had it done. And so you see that the cross that you see on the leg indicates that there's more of the dye sensitizer has been retained in the tumor than in normal tissue. So now effectively we have targeted that tissue. So now you shine a laser of the appropriate color onto the dye, which absorbs the light. The energy of the light is taken in by the molecule, which is a porphyrin molecule, and then passed on to oxygen, which is around in the cell, and you form a very special form of oxygen, which is called singlet oxygen, which is highly reactive chemically and is deadly for surrounding tissue. It's cytotoxic. It will kill all living cells. And so that's how you destroy the tumor. Well, that's fine, and cells cannot become resistant to this, so it will always work, but you have an added bonus. When the cell dies, it sends out a signal to surrounding cells, which then commits suicide, a process called apoptosis. So you amplify the damage caused by the light, and that's very beneficial in destroying the tumors. So this is, I'm going to show you some pictures of this in action. Here we have a lady who has a basal cell carcinoma. That's a skin cancer which is caused by too much ultraviolet light from the sun and does not metastasize. So this will not spread elsewhere in her body, but will of course get bigger and bigger unless it's treated. Now the surgery to remove that would be quite disfiguring. And so what was done in this case is the patient was irradiated with red light, and the reason why it's red light we'll see in just a minute, and the tumor was destroyed, as you can see from the slide now. Really 6 months after the operation, there was not even any scar tissue. You couldn't see where the tumor had been. So this was really a very, very highly desirable outcome, much, much better than surgery would have been. I mentioned that you have to use red light if you want the light to get into the body. And I can illustrate that quite easily, I think. If I take this green laser that we've seen, really quite intense, it's about 5 times more intense than a red laser I'm about to show you, and I put my finger over the end and then turn that to the camera. I can assure you the laser is still on, but you cannot see any light being transmitted through my finger. And that is because the blood and the other constituents of my finger absorb green light, and therefore you can't get light in to the body if it's green light, for example. Whereas if I take this lower powered red laser, I can get it to stay on. This little red laser is only about 1/5 of the power of the green laser that you saw. But now if I put my finger around, I think you should be able to see it coming through. Can you see that?
Yeah.
And so it shows you that red light is transmitted through flesh. So if you want to get light into the body, you have to use red light. But then you want the light to be absorbed by a dye, so you have to use a dye stuff which will absorb red light, and therefore it would look blue or green in colour. And so the dyes that we use are blue-green dyes usually. I'm going to show you another one now, which is the treatment of an internal organ, a hollow organ. This in fact is the bladder, and the light is introduced through an endoscope. This is an endoscope. This is a bundle of fibres. It's a rather old endoscope. This is a gastroscope. This is designed to go through your mouth down into your gut as far as the stomach and the first part of the duodenum. And you can shine light down here through this branch here, and so illuminate inside, let's say, the stomach. And when you have it in position, you can turn it in any direction you want. I hope you can all see that I can steer the end in any direction I want. So I can look round corners if I wish. Now, this is, as I said, an old-fashioned endoscope. It's a bundle of fibres, 10,000 fibres. A modern endoscope would use far fewer fibres just to get the light down, and at the end of the endoscope would be a CCD camera chip, which would transport the image back up just through 2 electrical wires and give you a much better resolution image, 100,000 pixels rather than the 10,000 you get from this. But endoscopes of this type are used widely in medicine for diagnostic purposes, but by using intense lasers in conjunction, you can actually carry out the operations that you need non-invasively, non-surgically. Physicians are able to carry out these processes. When you put light in, it undergoes total internal reflection down the fibres, and so appears at the other end. And I can illustrate a laser going down there simply by pointing this in the right direction, and if I take this little green laser and I now point it down, you should be able to see the laser light coming out of the end quite readily. Now, as I say, this is a low-powered laser. What we would use in the hospital is a high-powered laser to carry out the operations that you want to carry. So what we see in this slide is a patient who has a bladder cancer, and the top image that you see there growing on the wall of the bladder, which has to be removed. And it's removed using photodynamic therapy. The sensitizing dye has been injected into the patient, has accumulated in the tumour, and then we irradiate with red light again, and the bottom picture, which doesn't look too much different, in fact is now all dead tissue. It's been completely destroyed and now just breaks away and is lost in the normal way from the bladder. And the patient, as you'll see, a patient incidentally from University College Hospital, London, with whom we collaborate, a patient is very happy to look down into his own bladder and see the positive outcome of his treatment. I'm going to show you one more example of photodynamic therapy where the result is very beneficial. And again, this is taken from University College Hospital, which is one of the pioneering institutions doing photodynamic therapy in the UK. So here you see a slide which shows a tumour growing underneath the tongue of a patient, a very aggressive tumour growing quite quickly, and really must be treated. And the surgery in this case would be quite brutal. What was actually done was to sensitize the tumour using an available dye stuff, and then treat with red light, and you can see the picture 1 week after the treatment that the necrosis of the tissue, the tumour has stopped growing, it's now dead, and that tissue will be lost. And you can see 3 weeks afterwards you start to see regrowth of the tissue, but it's normal tissue which is regrowing, and then 6 months afterwards the mouth is perfectly normal. So as an alternative to fairly brutal surgery, you can see just how effective this is. And the important thing I think to realize about this is that these developments have arisen through a combination of work by chemists, biochemists, biologists, physicists and medics. And it's that combination of expertise which has allowed this kind of development to take place.